All right, so this one is for chronic issues. So longer than 3 months, it can be years. So a lot of times people come in, they just kind of deal with the pain, and that's okay, but it's still sometimes an irritation of the tendon, still irritation of the ligament, and then you have periodic areas of inflammation bouts, okay? So you might not be a chronic, like an inflamed issue, like an acute, where the whole thing is swollen, irritated, hot, and inflamed. This is like, oh, I feel good until I go and move, and then it flares up for a little bit, and then it goes down, okay? It's typically a mechanical issue that we work on with the chiropractic part of it, but how do we speed this up? So pain, of course, the go-to is Boswellia, okay? This is the gold standard when it comes to pain as far as standard process goes. Scar tissue. So if you've had this issue there for a long time and your range of motion's terrible and you can feel it, like you can feel stuff maybe tearing, ripping, clicking, popping, okay, you need some Gotu-Kola. Gotu-Kola, what that does is help loosen up the tissue. So whenever you actually do the therapy, the adjustments, rehab, whatever, it can actually allow it to move the way it's supposed to. And so it's not a super tight rubber band type thing, okay? Then we have chronic ligament issues, tendonitis, which would be more like a tendinosis in more of a chronic issue, but or an inflamed bursa, like chronically, okay? Or an old cartilage injury, labral tears, knees, meniscus, etc. Ligaplex 2, that's the chronic one you need to look at. Ligaplex 1 was for more of the acute issue. Boswellia, because there's pain involved. And then the glucosamine synergy. What this does is it helps improve the overall joint hydration. So it's a salt, your body absorbs it, water goes into it, it starts to make it a little bit more full, and it has actually where it's like not bone on bone, it's got a little cushion into it because it's now swollen because it has the proper hydration levels in it, okay? Nerve pain, that chronic disc issue, either disc narrowing, degenerative disc disease, etc. Neurotrophin PMG. PMG is gonna allow it to actually kind of calm down so it's not irritated so much. Neuroplex is more the food part. It's feeding good stuff to the nerve so it can heal. And the Nerviton Forte, that is basically there to help stimulate that area, because if that thing has been irritated, remember, like the weight of a dime can affect the conduction of the nerve. So what this does is it allows it to kind of get ramped up again and stimulated. So when we're doing our exercises, you don't feel like weak or imbalanced or anything weird, okay? All right, here's your crazy one for bone spurs, shoulders, elbows, heel spurs, whatever. Calamo. This one's like a weird magic one. What it does is it just helps really kind of shave off some of the ends of the bone spur, so your body allows it to actually absorb it without any problems. We kind of combine this a lot of times with ultrasound to just kind of speed up the process. But the bad thing is, if you got a bone spur, it kind of limits our rehab we can do because that spur is just tearing stuff up. So we need to get that bone spur gone. So here is our chronic supplement list.